Welcome to the ASCO University Weekly Podcast. My name is Dr. Alexander Drillon, and I'm the Clinical Director of the Early Drug Development Service at Memorial Sloan Kettering Cancer Center. Each week, members of our expert faculty will present a new episode based on either a self-assessment question, a new drug in oncology, or an ASCO guideline.
Hello, my name is Dr. Larissa Nekhlyudov, and I'm a primary care physician at Harvard Vanguard Medical Associates and a researcher at Harvard Medical School in Boston, Massachusetts. I will be speaking today about the importance of effective communication between the primary care physician and oncologist, especially as it pertains to the continuity of care for adolescent and young adult cancer patients. When a young patient is diagnosed with cancer, the focus of care shifts dramatically to the oncology setting. This is clearly needed, but what may also occur during this time is a disconnect between the primary care physician, the patient's oncologist, and the patient. This disconnect may affect the quality of care that the patient receives, particularly when the cancer treatment is completed. But there are ways to improve the communication and information sharing between everyone involved. First, what is the value of having a primary care physician during cancer treatment? Fortunately, adolescent and young adults are typically healthy prior to the onset of cancer. As a result, they may not have a primary care physician with whom they have developed a relationship. They may intermittently seek urgent care for minor illnesses, such as a sinus infection or a urinary tract infection. So when a young adult develops cancer, they may not even think that a primary care physician is needed, whether they already had one or not. Clearly, during cancer treatment, an oncologist is the main provider caring for the patient. But how can a primary care physician be of help at this time? During cancer treatment, a primary care physician can focus on the patient as a whole, assessing the effect of cancer and its treatment on the physical, psychological, and social dimensions. Are they able to play soccer now as they used to? How are they dealing with the cancer emotionally? Have their interactions with their friends changed as a result of cancer? The primary care physician can also focus on preventive strategies such as smoking cessation and exercise, helping to improve the lifestyle habits that have been shown to be critically important for cancer survivors. And they can also address any non-cancer related medical issues that may come up during treatment. Second, how can a primary care provider and an oncologist work together in caring for a patient during treatment and when the treatment is completed? Communication is needed. The primary care physician and the oncologist have to communicate regularly about the ongoing care of the patient. This does not have to be lengthy and may occur in many ways, including in person, if that is at all possible, telephone, or electronically via the use of medical records or secured email. However, patient involvement in this process is also needed. Often, even in healthcare systems with a shared medical record, communication between providers is not ideal and pieces may fall through the cracks. So even during cancer treatment, the patient should be encouraged to communicate with a primary care physician and, if possible, make an appointment for a visit. They should be educated about whom to call when. Whereas most of the issues that arise for adolescents and young adults during treatment are indeed cancer-related, some may not be and may be more appropriately addressed by the primary care physician. Finally, how does communication during treatment affect care after treatment? Many have recommended that a survivorship care plan be prepared at the conclusion of cancer treatment. This is clearly important for the adolescent and young adult cancer patients, for whom care often involves complex regimens and potential for late and long-term effects. But communication between primary care physicians and the oncologist, and between the primary care physicians and the patients during treatment, is also important. Staying in touch during treatment may help the patient transition to the primary care settings after treatment is completed.
For more information, visit our comprehensive e-learning center at university.asco.org. Thank you for listening to the ASCO University Weekly Podcast.
The purpose of this podcast is to educate and to inform. This is not a substitute for professional medical care and is not intended for use in the diagnosis or treatment of individual conditions. Guests on this podcast express their own opinions, experience, and conclusions. The mention of any product, service, organization, activity, or therapy should not be construed as an ASCO endorsement.